In the UK, where vaccinations and reopening efforts are further along, researchers behind a COVID tracking app have noticed a change.
Since the start of May, we've been looking at the top symptoms in all the app users, and they're not the same as they were.
A headache, sore throat, and runny nose are now the most reported symptoms, all milder than a fever or cough, which round out the top 5. People are sneezing more often too. Some experts think it's because most of the infected people are under 40 and less likely to be vaccinated.
It's more like a bad cold in this younger population.
Just have a seat here.
Those shifting symptoms could change how we track COVID in the future.
And what are your symptoms?
So I basically have like mild cold symptoms, sore throat, congestion, headache.
Toronto resident Jessica De Silva is getting tested just to be sure, but others with a mild illness might not bother. This testing clinic has its lowest level of appointments since the pandemic started.
Most of the people that we get, it's mandatory for work. Healthcare workers, private caregivers.
We're going to miss cases.
Some experts warn public health should refocus testing efforts to be more targeted, including in schools, since children under 12 can't get a vaccine just yet.
It's an important piece to redeploy testing into unvaccinated areas and use it as a tool there for control as compared to just expecting anyone who wants a test to go get a test.
Catching cases remains a priority since many Canadians could still fall seriously ill from COVID-19, even if others only have mild symptoms. That means testing anyone who might be infected, whether they know it or not. Lauren Pelly, CBC News, Toronto.
Okay, so let's bring in infectious diseases specialist Dr. Susie Hoda to expand a bit on this Delta variant. And I guess my question is, have we kind of on some fundamental level underestimated the Delta variant? What do you think?
We may have. I mean, we're hearing about the Delta variant being more transmissible than the types of variants we're commonly seeing here prior to it coming to Canada. But also, it is not something that we're able to detect as easily in the lab. So there's a bit of a lag in us understanding just how prevalent it is in any part of the country, just because of the tests that need to happen. But I think more importantly is if we're seeing a shift to milder symptoms, and especially as we're rolling out vaccination at the same time, and we may see that those who have the infection have milder symptoms, we could be losing that signal. And people may continue to interact and not realize that they're infected, not get tested. And that's a worrisome thing because it can allow it to continue to transmit.
Right, because someone who's been vaccinated may more readily dismiss these kinds of benign symptoms, right? Whether thinking of it as a cold or just seasonal allergies, but you're saying they should not be so quick to do that.
That's right. I mean, vaccination's excellent, and it's really, really powerful in terms of preventing people from getting really sick from COVID-19. But some people will break through and have infections, and they may have symptoms, they may have no symptoms. But those symptoms can be very mild. And it's still your signal that you need to get tested. You need to stay home if you get any symptoms that are mild.
Right.
Because that can be what prevents transmission to others and this continuing on.
Dr. Hoda, we're always learning. Thank you.
Thank you.